What is radiology? Radiology is a medical specialty that uses medical imaging techniques to diagnose and treat diseases and injuries. It involves the use of various types of imaging technologies such as X-rays, CT scans, MRI, ultrasound, and nuclear medicine to produce images of the body's internal structures. Radiology is a broad medical specialty that encompasses various subspecialties, each focusing on a specific area of imaging and diagnosis. Some of the major subspecialties of radiology include diagnostic radiology. Diagnostic radiology involves the use of various imaging technologies, such as X-rays, CT scans, MRI scans, and ultrasound, to diagnose diseases and injuries. Diagnostic radiologists interpret medical images and provide a detailed report to the referring physician. Interventional radiology. Interventional radiology is a subspecialty of radiology that uses minimally invasive techniques to diagnose and treat a wide range of medical conditions. Interventional radiologists use imaging technologies to guide small instruments, such as catheters, through blood vessels or other pathways to reach the site of the problem and deliver treatment. Nuclear medicine. Nuclear medicine is a subspecialty of radiology that involves the use of radioactive substances to diagnose and treat diseases. Nuclear medicine imaging techniques include PET scans, SPECT scans, and other types of molecular imaging. Pediatric radiology. Pediatric radiology is a subspecialty of radiology that focuses on the diagnosis and treatment of medical conditions in infants, children, and adolescents. Pediatric radiologists use imaging technologies that are specifically designed for pediatric patients, such as low-dose radiation techniques and sedation, to ensure the safety and comfort of young patients. Neuroradiology. Neuroradiology is a subspecialty of radiology that focuses on the diagnosis and treatment of diseases and injuries of the brain, spine, and nervous system. Neuroradiologists use advanced imaging technologies, such as MRI, CT, and ultrasound, to identify and treat a wide range of neurological disorders. Musculoskeletal radiology. Musculoskeletal radiology is a subspecialty of radiology that focuses on the diagnosis and treatment of diseases and injuries of the musculoskeletal system, including bones, muscles, and joints. Musculoskeletal radiologists use a variety of imaging technologies, such as X-rays, CT scans, and MRI scans, to diagnose and treat a wide range of musculoskeletal conditions. Breast imaging. Breast imaging is a subspecialty of radiology that focuses on the diagnosis and treatment of breast cancer and other breast-related diseases. Breast imaging techniques include mammography, ultrasound, MRI, and other imaging technologies that are specifically designed for breast tissue. Cardiovascular imaging. Cardiovascular imaging is a subspecialty of radiology that focuses on the diagnosis and management of conditions affecting the heart and blood vessels, including coronary artery disease, heart failure, and congenital heart defects. Radiology encompasses a wide range of procedures that use various imaging technologies to diagnose and treat medical conditions. The specific procedures used depend on the patient's symptoms, medical history, and the suspected diagnosis. Some common radiology procedures include X-rays. X-rays use a small amount of ionizing radiation to produce images of bones and other structures inside the body. X-rays are often used to diagnose fractures, bone infections, and certain lung conditions. Computed tomography, CT, scans. CT scans use X-rays to create detailed, cross-sectional images of the body. Quartz scans can be used to diagnose a wide range of conditions, including cancer, infections, and injuries. Magnetic resonance imaging, MRI. MRI uses a strong magnetic field and radio waves to create detailed images of the body's internal structures. MRI is often used to diagnose conditions such as tumors, infections, and certain neurological conditions. Ultrasound. Ultrasound uses high-frequency sound waves to create images of internal organs and tissues. Ultrasound is often used to diagnose conditions such as pregnancy, gallstones, and liver disease. Positron emission tomography, PET, scans. PET scans use a small amount of radioactive material to create images of organs and tissues inside the body. PET scans can be used to diagnose and monitor a wide range of conditions, including cancer and heart disease. Single photon emission computed tomography, SPECT is a type of nuclear medicine imaging that uses a small amount of radioactive material to produce 3D images of the body. SPECT is often used to diagnose and monitor conditions such as heart disease, cancer, and bone disorders. Interventional radiology procedures. Interventional radiology procedures use imaging technologies to guide small instruments, such as catheters, through blood vessels or other pathways to reach the site of the problem and deliver treatment. Examples of interventional radiology procedures include angiography, embolization, and biopsy. Nuclear medicine procedures. Nuclear medicine procedures involve the use of small amounts of radioactive material to diagnose and treat a wide range of conditions. Examples of nuclear medicine procedures include bone scans, thyroid scans, and positron emission tomography (PET) scans. Fluoroscopy. Fluoroscopy is a type of X-ray imaging that produces real-time images of internal structures within the body. Fluoroscopy is often used to guide medical procedures such as catheter placement and joint injections. Mammography is a type of X-ray imaging that is specifically used to screen for and diagnose breast cancer. It involves taking X-ray images of the breast tissue and examining the images for any abnormalities, such as lumps or masses that may be indicative of breast cancer. Bone densitometry, also known as dual-energy X-ray absorptiometry, DXA or DEXA, is a non-invasive imaging technique used to measure bone mineral density, BMD. It is primarily used to diagnose osteoporosis and assess the risk of bone fractures. What's the difference between the radiology and radiography? Radiology and radiography are related terms, but they have different meanings and applications in the medical field. Radiology is a broad medical specialty that involves the use of various imaging technologies to diagnose and treat medical conditions. Radiology includes a wide range of imaging techniques, including X-rays, computed tomography, CT, scans, magnetic resonance imaging, MRI, ultrasound, nuclear medicine, and interventional radiology procedures. Radiography, on the other hand, is a specific imaging technique within the field of radiology. Radiography refers to the use of X-rays to produce images of internal structures within the body, such as bones and soft tissues. Radiography is a type of diagnostic imaging that is used to diagnose and monitor a wide range of conditions, including fractures, tumors, infections, and lung diseases. In other words, radiology is the larger field that includes all types of medical imaging technologies and procedures, while radiography is a specific type of imaging within the field of radiology that uses X-rays to produce images of internal structures. Overall, radiology plays a critical role in the diagnosis and treatment of a wide range of medical conditions and injuries.